Ja, hi, mega cool, dass ihr alle
Hi, great to see you all here. I'm very happy that this topic of depression has the big stage and that there's so much focus on it. I'm actually really excited because of the amount of people I see here, but unfortunately we only have 30 minutes, so we're going to get right into it. Zoe, depression has a lot of faces. Affected people usually have a lot of different symptoms. They're quite diverse. How about you? What does it look like for you? I told you I'm gonna go right at it. Well, what does it look like for me? I usually have a very mild to medium course that when it runs. I have this for many years already, and I say easier or medium sort of way that it shows for me. I don't have the catatonic state where you can't do anything. For very long times, I don't have that, but I have a very chronic depression together with anxiety, which is quite often the case. This is roughly what it looks like for me. What other symptoms do you have? For example, me sitting here, this is the main result of the pharmaceutical industry. It's the only reason why I can be here. I took the train, and this was actually quite a feat for me. There were times where I couldn't leave my home. I have a lot of social anxiety, and the question about the symptoms is something I really didn't expect. That's why I'm stuttering about and fishing for words. Several million people are affected in Germany, so you can sort of do the mental math and figure out how many people in your extended family are affected. And the question can be, how do you deal with that? What do relatives of affected people deal with it? What relatives think is obviously quite diverse. It obviously also depends on how severe the affection is. The question is, what could I do? What would be the best for my partner, for my child, for example? And often the relatives think you actually have to get help and are getting desperate or despair over the fact that the affected people have this thought that they cannot do it. And this is very typical, that they have this feeling that they can't do anything about it, that nothing will work. And they can't concentrate, they can't focus. And for relatives, it's a question of listening, having patience, again and again, like connecting with the person. And still you may, as a relative, feel quite helpless, just as helpless as the depressed person. And this question of helplessness is a very strong sign of depression. So you're personally affected. So what would you wish, or how would you wish to be treated with your depression and anxiety by your relatives and others? Mainly, I would like to see it being treated seriously. Often they tell you, get it together, walk outside, take a walk, get some air. Movement obviously should help, but what does that mean for you inside? And when someone tells you that, this is usually leading to the opposite reaction. You're usually feeling quite opposite from what they expect you to feel or what expect you to do. And I go into a refusal or denial. And it's the acceptance of the fact that you can't function all the time, that you can't do everything that is being asked of you. And just as Babette already said, you need a lot of patience, and it is obviously very difficult, and I understand that others want to help you, but they come with good advice, and they're obviously quite correct, but your own speed at which you process this, or the speed that I have, that I need to accept this, doesn't work. And how do you communicate this to your relatives? I have decided years ago that I have to be quite open about it, because if every meeting that you have, every party that you're invited to, you have to cancel because you already know that you're not going to make it if you're going there. So every time it takes me like 3 days to recover from that. So I'm quite open about it by now, and now I get invitations to parties, and they basically now tell me, okay, we know what we're going through, and just in case you feel like it, come, otherwise it's okay. But other people just retreat, and because they don't really want to deal with this. And obviously, every time you come out with a certain disease, you basically have to filter your phone book because of how people deal with it. So all of this feels quite passive. Some relatives want to help actively, and the question is how to do that. Yes, there's a lot you can do, but every person is different, and relatives could try to figure out if it's a help, maybe to make an appointment for them, or maybe in certain phases do their shopping. Just those little things that they can take off you, and that lightens your load. And one of those things that I outsourced, because I know that I can't deal with it myself, because it's very difficult for me at that moment, I reached out and got some help, and that is obviously a very privileged situation that I'm financially able to pay people to do that stuff for me. That obviously doesn't work all the time. So if you're looking in your circle of friends, that if there's something you see that you can do for them, even just like doing laundry or helping them clean up, that would be a great help, because in difficult situations you're not capable of doing that. And it's also very difficult as an affected person to take that help, that when they reach out to you. And it helps if you already talk about it in when you're in a healthy phase, so you can discuss it ahead of time. And it's just these little things that really help. Don't demand too much. Those are things from my point of view that would really help. And I would definitely support this. This is what relatives can do. You can ask, you can just talk to them. Ask if you can do something for them in these daily chores. But even this can be too much in a very serious depression. If you have a dark phase, sometimes they can't even answer. Someone asked, and the person with the depression said, it still feels like you're not there for me. That's because depressed people have a different way of perceiving the reality, and it's not the same as if you were healthy. So for relatives or for other people, the important part is not to feel set back, but rather ask again. They often have such strong feelings about the person, and that they're feeling deeply that they're being hurt and that they're in a dark place. And you just have to tell them, I would really feel better if you were trying to get help. And then relatives should get into action, take them and say, okay, let's go and get help. And especially the most important thing is, sometimes people get suicidal. Those are the most severe reactions. And if that happens, then you just take the person, go into the next ER and into the next ambulance, especially a psychological one. And because that is the case, you cannot guarantee anymore that the person can take care of themselves, and may even harm themselves or kill themselves. And this, when you have a less severe case, it's just a friendly, continuous connection that you keep with them. We do know that movement helps, for example. Just try to get them to do it. But obviously it is incredibly difficult for the person to do that, and just getting their motivation up to a point where they can do that, or getting their motivation up to go into therapy. Or we actually know that psychological treatment is the best thing we can do in cases of light or medium depression. But also obviously there's psychological meds that you can use that really help. And this is also the experience that I have, that the combination from a psychologist or a neurologist telling me things or speaking to me and helping me. And we also had a long trial and error process of getting the right meds, and especially for me with the anxiety, finding something that would help with that was difficult. But let me say, not all of it is going to go away, but it's definitely better by a lot. And there's also like behavioral therapy that really helps. I've already done all sorts of things like talk therapy, but you have to find or figure out what is best for you. And I know people who say, yes, I would like to go to therapy, but it takes so long to get a treatment, like a position with a doctor or an open spot. And then they keep telling me that for like 5 years. And even if they've been telling me that for 5 years, and even if it took like 6 months, which is a lot, then they would already be done 4.5 years. But for me, it was kind of a coincidence that during the right phase, I just slipped in ahead of the queue and just got a spot. And I can definitely recommend getting help from a psychologist or from a therapist. And you don't have to fear the treatment. I know a lot of people are afraid of getting meds, and it's realistic, but don't worry about it. It's better. I also have to say we have to change something about the system. We need to have more treatment spots, more open slots with the doctors so they can provide treatment for the affected. And there is scientific evidence. I am a clinical scientist. We're doing research on this topic, and we can tell you that there's a lot of help online against depression, and we know that they can help, and they are actually available from all sorts of health providers or health insurances. You can look it up on the internet. It's actually quite helpful, and I'm really happy to say that in preparation for this talk, there is also now a treatment for relatives that they can use, relatives of depressed people. It has videos, it's interactive, and it's on the platform of a specific German health insurance. You don't have to use that one, but obviously there are others, and it's gotten a lot better. It's great to do this during the time where you have to wait for your treatment spot. Is it on the homepage? Yes. For the AOK, the specific German health insurance, it's on their homepage, and if you find the right link, you'll find it there. Okay, another question about this point that we just talked about. If I'm a relative of an affected person, how far should I push them, or where's the point where I need to stop? Zoe, what are you saying? What was it for you? What do you mean by push, And what do you mean by where's the end, or where should you stop? Should I write them every day? Should I write them every morning, every evening? Should I stand in front of their door and just say, okay, let's go out and do some physical therapy? I have a list of therapists here. Let's just call them all. Maybe not every 10 minutes, obviously this is different for everybody, and it always depends on the phase that you're in, and you can also look for the signals that they're sending, and if you don't wait for them to come, maybe just approach them. Even if you're saying you just wrote them yesterday, maybe ask them, hey, what is up? Of course, it's quick for it to get too much, It's one of those sentences in that situation. Anyone who has someone in that circle who is affected, if the person says everything's too much for me, then this is a warning sign that you have to really look out for. And the person often cannot say what is too much, because everything is too much. Even the simplest things, walking through the kitchen, getting up, using your dishwasher, anything, saying it's too much, I can't do it, I'm sorry. Those are the signs where you can see that something's happening. And Babette, just listen, What is the affected person saying? What do they want? Just make them offers. Just very baby steps. maybe don't get them into the gym, but just get them outside, take a walk, and do that regularly. Offer it again and again, but still be okay if it doesn't work out and if it doesn't happen. Those are, depending on how severe the depression is, and obviously also what your relationship to the affected person is. The idea is just communicate, ask, and ask what is good, what works for them. I liked all of your ideas that you just said. Just to communicate with them and ask them if that's what they want to do.
Yeah, I mean, we've had a lot of. When dealing with depression, it's not just about knowing as someone who's related to you to know how to deal with the person who's affected, but you also need to find a way of dealing with the situation for yourself, right? For example, imagine suddenly the best friend or partner is a different person, was maybe incredibly active, always up for doing anything, and all of a sudden they're not even interested in sex anymore. So how can friends, family deal with that? I mean, I think the first thing is they should know that, for example, losing your libido is a symptom of depression. So that means knowing things about depression and gathering that knowledge probably makes sense. And then there's still the question of, well, what do I do with that? And that's what I meant earlier when I mentioned patience. It requires an enormous amount of patience. Staying with someone for a period of time like that, not leaving. For people who are affected, for them it feels like it's never going to stop. But the good news is it will stop. It does get better, and there is help and support. And maintaining that belief as a relative there is incredibly important. I think in those phases, I'm afraid, I mean, you are almost a different person or may seem like a different person, and you can't act or react the same ways as you usually could. And as a relative, in those situations, to stick with it, right, and to persevere, because all of a sudden there is a different person sitting there. I mean, I think sentences such as, but usually you like that, or you used to like that, and that's not very helpful, unfortunately, because, okay, well, maybe there's a different phase right now, and you need to get to know this person in a new and different way. And with, I think, like all grave illnesses, there isn't just the single patient, but even people who are close to them are ultimately also patients. Yeah, I mean, personally, it would be incredibly hard to me as someone who's related to you, dealing with that feeling of being rejected. For you, did you lose friends or did relationships end? Yeah. I mean, yeah, you essentially rewrite the telephone book, right? Some people are just gone, and you learn that these people aren't willing to give you support, and that for some of them it's too difficult. And then sometimes, surprisingly, maybe it turns out that people who you didn't expect to be able to depend on. I think that's where the circle of friends gets remixed, right? So as a person who's affected, you also get to know, maybe unfortunately or fortunately, your friends in a completely different way. So, right, you just mentioned understanding, and being understanding is incredibly important there when dealing with depression, psychological education, learning about depression, understanding what's happening to the person who's affected, being able to place that in better. Are there maybe any other tips or suggestions that you might have for people who maybe are in a situation like that right now? Yeah, I mean, this isn't a nice tip, but it means knowing your own boundaries and limits. That's incredibly difficult because you want to help, but there is a limit. No matter how good your intention is, there are limits that you need to accept, also for your own protection. And I think it's important when it comes to that self-care, that is important to continue self-care even also as a relative, and to recognize that it's not in your power to make the depression go away. You might want to, but you can't do that. Oh, sorry. Yeah, that's what I mean when I say they're also patients together with the person who's depressed, right? Because sometimes relatives, family also sometimes should also go get counseling, because it's not like they're trained care personnel, and once you have a relationship to someone who is sick, you need to protect yourself, and you need like your own space to retreat to. Yeah, and sometimes that's incredibly difficult to perceive that limit or that boundary. There too, communication is important. It helps to talk about it and accepting that something is the way it is. And sometimes it's incredibly difficult, especially, for example, for parents who have children who might be depressed. It's incredibly difficult to help, but simultaneously to recognize that that it's not entirely within their power. There are a lot of things that they can do well, and they can support them very well, and that support is incredibly important, but most of the time that's not enough for making everything be okay. Yeah, when we spoke before the podium, that the title, this gray clouds, is very fitting. That's exactly what you're talking about. These gray clouds kind of come up. You can't do anything against it. Maybe like some cases they show up exactly the moment you can't do anything about them. It's the worst possible timing. But it sounds so incredibly passive. I want there to be something active that you can do as a person who's related to someone who's depressed, something you can do to help. Support, right? Like helping to find psychotherapy, supporting with the search for therapy. Isn't there anything that we can give the audience to take home? I mean, go look at the websites I mentioned. Inform yourselves, and with any psychological conditions or diseases, for example, especially dementia, it's the person as such a different person. That's incredibly hard to accept for anyone, that a person who you might have gotten to know or might have known as someone who's incredibly active, that person suddenly isn't that active anymore. And one thing you can maybe actively do is try to accept that it's a disease, that this person is not doing it on purpose, and understanding that. And that requires a significant cognitive flexibility. It's an enormous task, but I think it helps, and also helps oneself, and maybe also people you're related to. And sometimes it doesn't have to be something incredibly active, because sometimes when there's another person who's just there and accepts you and is just sitting next to you, just being in the same building, and there is someone. For some people, that's very helpful, that someone is just there, I think.
And how do you deal with that? How do you feel about it? If you have a very good friend who's just with you, chilling with you. I have 2 cats. Okay, you have 2 cats. Well, no, seriously. How about your consciousness? You know that you can't do anything about it, that you can't be any different. And I obviously have a bad conscience because I just lying in bed and I can't do anything and I can't work. And there's the capitalist afterthought of, always having to work. And you have to be capable to deal with yourself and to help yourself. And you have a bad conscience, obviously. It's always with you. I don't work right now. Like, in a way, I don't function. I'm broken. I fail at life, and feeling as a failure, I have a bad conscience. And obviously I answered with cats because supposedly they help. Some people it helps, yes. And like if you have a dog, for example, that you have to walk, that's also good. But I know which people I can depend on. I know who's there for me. Where I live, it's a very respecting, very reliable community in my house. where everybody knows about each other and where we distributed keys around and everything's taken care of. And over the years and decades, I found a way that works for me and that works. But if you have a very acute case, and if it's like showing up from one day to the next, and relatives obviously have to very extensively inform themselves about what is going on, and there's a lot to learn, as she just said, and you also have to recognize the fact that not always can you do something actively about it. Communication is key here. Maybe the affected person is communicating that I have a bad conscience right now and I would like to, a good company for everyone, but I can't. And the related person then has to say, okay, yeah, I understand it. I'm sorry, but it's okay. You can be like that. That's okay. We have 4 minutes left. So should we give the people in the room here a take-home message? What are the most important points that you think is crucial when dealing with depressed people from the view of a relative? Yes. Don't exert any pressure. And I want to emphasize this once more. Just accept that it's not a phase or like a whim. It's just an illness. That needs treatment. And I want to add to that, just listen, stick with them, make them offers, inform yourself, and accept that there are also limits to your own capability of doing something about it. Definitely. As a relative, it's easy to break yourself over this situation, If you feel the responsibility, the weight on your shoulders for this situation, that's just not possible. You have to surrender this, and it's not going to help anyone, even like if the related person to the affected one is also getting a burnout and broken after the situation because they have this feeling that they're responsible for it, and especially all the time. Self-care is a very important point, yes. And obviously help, yes, professional help. There is help, and it is usually psychotherapy. There's also pharmacological help, psychiatric help, by neurologists even just your general practitioner know how to deal with depression. But even the whole society has advanced a little bit. My impression is also that the general practitioners have gotten a lot better over the years. And obviously, again and again, just tell them it would be great if they really now accept help, if they try and reach out. And if in the worst case, just call the emergency number or the telephone hotline, or there are different hotlines that you can call for psychological support or just for talking with someone if you have issues. We're going to add that on YouTube that show you where you can call, especially in Germany. There are different numbers that you can call and where you can show up. Okay, this is the end. Thank you very much. It was great. I really enjoyed it. Thank you all. And enjoy the rest of the Republica.